episode of Chamber Chats, we're joined by Annalise Smith, Chief Philanthropy Officer at AVOW Foundation, to talk about how compassionate care, grief support, and community generosity come together to make a difference in the lives of Southwest Florida families. In this podcast, we will explore the difference between palliative care and hospice and when to know when each one is right. We'll learn about how AVOW's grief support services help children and adults long after loss. And we'll learn ways the business and broader community can contribute through volunteering, donations, and advocacy. Whether you're looking to better understand end-of-life care or searching for ways to give back, this episode offers meaningful insights into the power of community and compassion. Thank you so much for joining me today, Annalise.
It's my pleasure.
So how long have you been with AVOW?
I've been with AVOW for more than 12 years.
Wonderful. So tell me, what is AVOW?
AVOW is a community nonprofit based here in Naples, Florida, serving the Collier County community and beyond. Our brand of healthcare is end-of-life care and treating people with chronic and serious illnesses, helping people through grief and loss, and that's done through our hospice, palliative care, and community grief programs.
Wonderful. Does AVOW stand for something?
No, it doesn't. Okay. Well, yes, it does. A vow to care for our community.
Oh, wonderful. I've always been curious. So talk to me a little bit about palliative and hospice care. What does each one mean, and how do you know when to choose?
Yeah, a lot of times people are sort of confused by the two terms. Hospice is actually a form of palliative care, and AVOW is known for hospice. We've been serving our community since 1983. Hospice is our core business. Founded by a group of feisty volunteers who recognized a need for people to have support at end of life. Hospice is a benefit through the federal Medicare program and is funded in part through Medicare reimbursements. And it's for people who have a life expectancy of 6 months or less. We come to that realization through collaboration with physicians, community referring physicians, as well as our own hospice physicians, to determine that if a person's the course of their life, or the life takes its natural course, that they would be expected to pass away within the next 6 months.
Okay.
Hospice is for people who are not pursuing aggressive or curative treatments. They're ready to say, I'm going to let God take the wheel and let life take its natural course. Palliative care, on the other hand, is for people who are suffering with life-limiting, chronic, serious illnesses, but are pursuing aggressive treatment, curative treatments. People who have things like cancer or Parkinson's disease, neurodegenerative diseases, congestive heart failure, liver disease. Maybe they're having chemotherapy, radiation, or other treatments with hopes of getting better. Palliative care and hospice both work in the same way in that our goal is to improve quality of care for the patient and their family members so that we can make sure that their pain and symptoms are under control.
Okay.
We want to ensure a dignified and comfortable death, and we want to make sure that people who are living with these long-term chronic illnesses, having lots of treatments and that sort of thing, that the benefits and burdens of those treatments are equally weighed and that we can manage pain and symptoms and they can live a high quality life. In both hospice and palliative care, we also do a lot for the patient's family caregiver.
Okay.
A lot of caregiver support. It is a hard job to be a family caregiver. In hospice, we do really hands-on care, so we can provide help with medications, durable medical equipment. We actually visit the patient at home, wherever they call home, or they can receive care in our hospice house. So it's a very hands-on care delivery model. Whereas palliative care is more consultative.
Okay.
So in palliative care, we're working in conjunction with the community physicians to advise and help work, again, with pain and symptoms, but we're not really taking over the care.
Okay.
So those are a few of the differentiations.
Well, and then AVOW's grief and loss programs go beyond the funeral. Can you share about the services, how they work, and how they're designed to support?
Yeah, absolutely. So I mentioned the family. We work with the family while we're delivering care to the patient, and then ultimately when the patient passes away, we want to be there to support that family through all of the firsts. So the first anniversary, the first wedding anniversary, the first birthday, the first holiday season. All of those milestones sort of conjure up some difficult feelings for people. And so we do both individual counseling as well as group support for people who have experienced loss. And we have all sorts of different groups. So we use a cycle of change model in order to determine where an individual is in their grief process, because everybody experiences grief in a different way. You know, some people get over things very quickly or are able to move on very, very quickly, and other people take a little bit longer. And so we need to be able to customize the support program to the unique needs of every individual. And so we use this cycle of change model to be able to do that, to help get people plugged into the right group at the right time so that they are able to network with other people who are at the same stage as they are. And it's amazing. We have people that we call them graduates of our grief program, and oftentimes they, within that group, continue to do social things together for extended periods of time. I run into people frequently and they say, oh yeah, I still get together with my grief group and we have dinner once a week, or we get together for the holidays, or those sorts of things for years after they've completed the program. So it's a really, really special relationship that they're able to gain with
through that
groups.
shared experience.
Yeah.
And grief isn't linear, right? I've heard it
Absolutely.
like an onion. I mean, a couple different metaphors. So when you're experiencing grief, it may not even necessarily, if you feel like you need support, it doesn't mean it had to have happened yesterday.
Oh, absolutely. And the other important thing to understand with our grief programs is they're not just for people who have had a loved one that's passed away under AVOW's care.
Okay.
You know, we live in a community where people come here from all over the place, right? So it's a true community grief program. If you have a loss that occurs in some other state, we still want you to avail yourself to support through our programs. It's open to anybody who needs it. We also have a unique program for children.
Okay.
It's called AVOW Kids. Through AVOW Kids, we have, again, individual and group support programs, as well as camps and workshops for children ages 5 to 17. Because we can't do the same type of programming for a 7-year-old as we do for an adult, of course. And some of our graduates from AVOW Kids transition and they move into our adult grief support program. So, like you say, it's not linear, and with children especially, a child who experiences a loss at age 6 may resolve that loss for a period and be doing very well. And then as they maybe move into their teenage years, there's a whole new need that they have. And so they kind of ebb and flow and come in and out of the program as things change with them, and we welcome that.
And if I understand correctly, it's not necessarily only exclusively designed for loss, but grief in general, right? So maybe deployments. I think I understood maybe like a close friend moved away. Tell me a little bit more about that.
Yeah, so in our kids program especially, we work with children who have had all sorts of loss. Children who are maybe in a household where they're enduring a divorce, children who have been through the foster care system, children whose loved one or guardian has been deployed in the military. Maybe they're just absent temporarily. So all of those types of things. Now, we can't deal with all of those types of loss in the same way. So we have segmented groups that are intentionally designed to work with children in those specific ways.
So what are some things that people may not realize about the impact of hospice and grief support and what that has on a family?
Families can be dramatically impacted in that children have a difficult time performing in school. Adults have a difficult time performing at work. Absenteeism, tardiness, managing family budgets, simple everyday to-day tasks. So our goal is to help people develop coping skills and coping mechanisms so that they can really be able to enjoy life again and thrive and be productive members of the community, be successful in work and school, and have healthy relationships
Yeah,
with
well,
others.
that's wonderful, and I'm sure that must be incredibly rewarding. I mean, I think, every community that an individual that deals with something like that, a strong community comes from having kind of the support that you need in all these different stages of life, right?
Absolutely.
So tell me a little bit, because I know that when you talk about your public events that you have, you're known in this community for a beautiful butterfly release.
Yes.
Tell me more about that.
Yeah, the butterfly release is an opportunity for us to bring the community together in Cambier Park, outdoors, and have a public remembrance ceremony. Contributors can make a small donation in order to have their loved one's name read aloud during the ceremony. We read almost 1,000 names every year in just an hour and 15 minutes. It's amazing that we can do that so nicely, but it's a way for people to come together again in their grief. We have a beautiful exhibit with live butterflies that we have in a tent that our participants can walk through the tent and engage with the butterflies.
Yeah.
We have activities for children and music and that sort of thing. And then at the end of the remembrance ceremony, we release the live butterflies into the park.
Oh,
and
wow.
it's a symbolic situation where, a rebirth, a new hope type of thing.
Yeah.
And it's really very touching.
That's so
touching
nice. Are there any
that.
other annual events that take place that you'd like the viewers to know about?
So the butterfly release is our signature event, so to speak, but we have events going on all the time.
Okay.
We are a nonprofit organization, so we do a lot of fundraising. We have fundraising events coming up soon. We have a trivia night that's going to be taking place on our campus. But I would encourage people who are looking for ways to get involved with us to check out our calendar online at
Sure.
avowcares.org to know what's going on this week and next.
Okay, great. So if there's someone who maybe hasn't used the services for end-of-life care, but they think that themselves or someone in their circle may need your services, what's the best way to go about accessing those?
So first and foremost, don't wait. So many people who have been touched by our care come to us afterwards to express gratitude, and the first thing they'll say is, "We wish we had reached out to you sooner." So reaching out to us by phone or online, we have a contact us page through our website, but we answer our phone 24 hours a day, 7 days a week, 365 days a year here in AVOW. We don't have a call center in another state or area. We pride ourselves on having our own staff members answering the call. So we're here to serve. We're happy to answer questions. We typically offer to send a nurse to the home so that we can talk with the patient and family about their needs and help determine which type of care would be most appropriate for them. And we're only a call away.
Good. Well, thank you for that. If there are listeners that are interested in supporting your work, how can a business or individual do that?
There are lots of ways to get involved with AVOW. We rely on volunteers greatly to do our work. In fact, a fun fact is that Medicare, hospice is the only Medicare-funded healthcare delivery program that has a volunteer requirement.
Okay.
In order for us to stay in good standing with Medicare, we have to prove that a minimum of 5% of our care that's delivered to the patient every month is delivered by a volunteer.
Okay.
So we're delivering tens of thousands of hours of care to patients every year, and we rely on a lot of volunteers to help us do that. Volunteers provide respite care in order to give a family caregiver a break so they can go and get their hair cut or have a doctor's appointment of their own. And we also have volunteers that provide companionship visits to patients in long-term care facilities or even in homes who don't have family caregivers or frequent visitors. Just an opportunity for them to have someone to chat with.
Sure.
Maybe talk about current events or common interests and that sort of thing. We have volunteers that help us in our offices and at our events through AVOW Kids. There's a job for any type of interest, any skill set or experience. We always welcome donors. Again, we are a fundraising organization. We have about $4 million worth of our programs and services every year that are funded through philanthropic dollars. $4 million.
Incredible.
These are things like music and massage therapy, the bereavement programs, some of our palliative care services, our veterans program. All of these things rely on the generosity of our community in order to be sustained. And then just being ambassadors of our care. If you see a friend in need or you have someone that you know in your life that is struggling with a chronic or serious illness, encouraging them to reach out and find out a little bit more about our services. One other thing I forgot, our Treasures resale shop.
Oh.
So we have a resale store. It's at 9765 Tamiami Trail North. That's one of the ways we raise money.
Okay.
Some people donate goods, clothing, household items, furniture, those sorts of things. They can be donated to Treasures. We pick up, or they can be dropped off at our location, and then we sell those items, and the profits go towards our programs and services.
Oh, wonderful. And if someone wants to walk in and speak with someone, where is your campus located?
Great question. We are at 1095 Whippoorwill Lane. We're right off of Pine Ridge Road, close to the I-75 interchange.
Great. And then I assume getting a hold of you, phone number, all of that available on the website?
Yeah, our phone number is easy. It's 239-261-4404.
Okay.
And our website is avowcares.org.
Very good. Is there anything that we haven't touched on that you want to make sure our viewers know today?
Just that AVOW is an amazing community resource that we hope that people will be sure to avail themselves of when the time is right. And if you're not sure when the time is right, just give us a call or reach out and we'll be happy to help you in any way that we can.
So Annalise is a graduate of our Leadership Collier program, and Leadership Collier is an initiative of the Greater Naples Chamber. Tell us a little bit about what your Leadership Collier experience was like.
My experience was fantastic. I was part of the class of 2010, the best that's ever been, and the experience truly opened my eyes to all of the different sectors of our community that impact me, not only as a citizen, someone who loves living here, but also in my business. I was able to make some really fantastic and valuable connections with people that I otherwise probably would have never interfaced with. And those relationships have really stuck for me, and they're people that I can reach out to when I need help or a connection with somebody else. And it's really a fantastic supportive group. There's been some really great opportunities for alumni as well to continue extending that network. And there's just a really special camaraderie that I feel like we all share.
I'm so glad you enjoyed it as much as I did. So AVOW is a valued member of the Chamber of Commerce. And so tell us a little bit about what your membership experience has been like and why others should consider joining the Greater Naples Chamber.
Absolutely. I think being a member of the Chamber is essential for a business owner or someone in a leadership position at their business. It's the best way to be in the know about what's going on in the community, not just related to business, but in all sectors. And the communication is great. I find out a lot of really important things that are going on in our community through Chamber communications, and the events offer opportunity to network and create valuable relationships that help us in the work that we do.
Yeah, well, thank you for the work that you and your team do for this community. It's very clear to see if you feel like you're in need of these services or someone in your network, that you've got someone you can call that can coach you through exactly how to access all of that. And if you are an organization that wants to support the fantastic work that we do, that Annalise and her team can help get you connected. So thank you so much for spending time sitting down with us today.
It's my pleasure. Thanks for having me.
Thank you so much. Thank you again to our guests for joining us and for sharing their insights on today's episode of Chamber Chats. If you are interested in sharing your own story and you would like to be featured on a future episode of the podcast, we'd love to hear from you. Reach out to the Greater Naples Chamber to learn more about how to get involved. Thanks for listening, and we'll see you next time on Chamber Chats.